Rajim. Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this Saturday morning on Radio Al Ansar 90.4 and 105.6 FM. I'm Shabnam Ismail on the Pmb Pulse show, capturing the heartbeat of the community. It's also Women's Day, and to all the amazing women out there celebrating your strength, resilience, and achievements, empowering women, empowering humanity, wishing you a day filled with love, joy, and recognition. Today, I am honored to introduce Dr. Raksha Takoordeen, a highly respected and renowned pediatrician based in our city of choice, Pietermaritzburg. Dr. Takoordeen's passion for medicine is rooted in a personal experience of miraculously surviving a congenital tumor, which sparked a desire to help others in need. With a warm and friendly approach, Dr. Takoordeen's practice provides comprehensive and holistic healthcare to pediatric patients from newborns to teenagers. Her focus on the entire family creates a nurturing environment that fosters positive growth and development for every child. Her dedication to her patients is evident in her continuation of care from the onset of treatment to completion and long term follow up. Let's join Dr. Takoordeen in conversation and learn more about her inspiring work. Welcome to the show, Doctor.
Thank you, Shabnam. Thank you so much for having me on this beautiful Women's Day.
Excellent. Today we'll be discussing Dr. Takoordeen's experiences as a pediatrician, her approach to healthcare, and her commitment to community outreach. We'll also explore the importance of pediatric care and the role that healthcare professionals like Dr. Takoordeen play in shaping the lives of children and families. Let's take a quick ad break and we shall unpack the world of a pediatrician shortly. Assalamu alaikum wa rahmatullahi wa barakatuh on this beautiful Saturday on the Pmb Pulse show with myself, Shabnam Ismail. And today we are joined by Dr. Raksha Takoordeen, a leading pediatrician with a passion for caring for the tiniest and most vulnerable patients, and with her expertise in neonatology and premature kids. Dr. Takoordeen shares her insights and experiences, and we're so excited to have her on the Pulse show. Welcome once again, Dr. Takoordeen. And I know that it's also International Breastfeeding Awareness Week. Can you tell us why breastfeeding is so crucial for both mothers and babies, and what benefits can it provide for their health and well being?
So, Shabnam, for me, this is my passion topic. And over the years, you would have heard them say having a baby is meeting for the first time someone you already love. How profoundly true. So, wouldn't it be nice to have a feeding solution that was always at the correct temperature, didn't need any boiling or cooling, was always immediately available day and night, anywhere, had all the nutritional requirements of the baby, no matter what age the baby is, and didn't require special bottles, teats, and cause the baby's poo to be so pleasantly smelling that nappy changes are the greatest pleasure? Well, and it's also free of charge. So, as nature would have it, there is a solution, and this is breast milk. So, Shabnam, breast milk and the benefits of breast milk are twofold, not only for the baby, but also for the mummy as well. So, for the baby, it is the most natural way to feed your baby and contains all the nutrients your baby requires in all the right proportions, exclusively for the first 6 months of the baby's life, and thereafter as a complement to solids until 2 years of life. And this is the WHO recommendation that you should ideally be breastfeeding until baby turns 2, and then beyond if you so wish to do so. So the composition even changes as the baby's needs change as baby grows. Breast milk is loaded with antibodies that help fight off infections, which is critical during these tender early months. This particularly applies to colostrum, which is the first milk that baby receives after birth. And I call this liquid gold because that's what it is. Immune protection happens continuously. As the mother is exposed to organisms, she produces antibodies, and this is transmitted into the breast milk to provide continuous protection to the baby. Breastfeeding, and especially exclusive breastfeeding, reduces the baby's risk for a multitude of acute and chronic diseases and illnesses, including middle ear and throat infections, pneumonia, diarrhea, and it's linked to a reduction in SIDS. And SIDS is a topic that is we should discuss actually at probably at another stage, but this is sudden infant death syndrome. This is literally finding your baby dead in her cot in the morning, and we don't know how it's happened. At the moment, we don't have any reason, any causes for SIDS, but breastfeeding has been associated in reducing the incidence of SIDS. And it reduces certain other chronic conditions like allergies, example, asthma, diabetes, inflammatory bowel disease, and even childhood leukemia. Breast milk promotes healthy weight gain, and it helps to prevent childhood obesity. So there is a hormone that's present in breast milk called leptin, and this interestingly controls appetite. So breastfed babies don't ever overfeed. It also enhances brain growth and development, and studies have shown that breastfed babies have higher intelligence scores and are less likely to develop behavioral problems later on in life. So that's just the advantages for the baby. Let's talk about advantages for mum. So the immediate effect is reduction in the risk of hemorrhage immediately after delivery because it enhances uterine contractility. It helps create the most loving, beautiful bond between mum and baby. It helps weight loss, and all mummies are always worried about losing that baby weight. Breast milk will help you lose that weight, mummies. It reduces the risk of breast and ovarian cancer and osteoporosis later in life. and it just improves emotional well-being. So you are less likely to develop postpartum depression and blues if you are breastfeeding. It's related to a decreased risk in the development of other chronic conditions like hypertension, like arthritis, like heart disease, type 2 diabetes, which is very common in our society. And continuing to breastfeed also prolongs the onset of menstruation after delivery, but this must be said that this mustn't be the method of contraception. And of course, it's cost effective, it saves time, it saves money. So, in a nutshell, those are the advantages of breastfeeding for mom and for baby, and the list can go on and on and on.
And tell me, doctor, how can new mothers overcome common breastfeeding challenges such as latching or low milk supply?
So, breastfeeding is a process that has to be learned by both mum and by baby, especially first time mummies. Remember, baby doesn't know how to breastfeed, right? So, this is a process that must be embraced and it must be learned by both mum and baby. The staff at your birthing center is trained to assist mum to latch. The first feed must ideally happen as soon as possible, and this is usually within the first hour after birth, and we are promoting this as much as possible as soon as baby's born, whether it's through a normal delivery or through a cesarean section. The quicker you try to latch baby, the better for you and for the baby. So I just want to, at this point, go through the signs of good latching, because this is where mums feel like they can't do it, or this is sometimes where the wheels fall off a little bit. So there are a few signs that will tell you whether you are latching baby well. And one of my one of my things that I do in my practice, and I think as a woman I have that advantage, is especially for first time mummies.
Yes.
When they come in for their first visit, and even if in the hospital, if I'm there during a feed, I will actually show mom how to latch, how to position the baby, and make sure that the latch is good. And I think as a female, that gives me such an advantage. So signs of a good latch: baby's mouth must be wide open with the lower lip turned outwards, the nose must be clear, and it must be gently touching the breast. With good latching, with good positioning, the breast shouldn't obstruct the nose of the baby, and the areola must be mostly in baby's mouth. So this is important. The initial latch is very painful. So I can attest to that. You feel like you've been stabbed through your nipple, but I promise you, as you continue breastfeeding and as you continue with good latching, the pain actually goes away. Whether this destroys the nerves in your breast and your nipples, I'm not sure. But after a while, you don't feel the pain. And if baby's latching well, after that initial latch and through the rest of the feed, the pain actually goes away. So remember also that when baby's feeding, there should be no clicking noises with the feeding. And baby should be quite calm once the feed is complete. A good breastfeed is 20 to 30 minutes long, and this should satisfy your baby for at least 2.5 to 3 hours thereafter.
And can breastfeeding protect babies from allergies and illnesses?
Absolutely. So breastfeeding can prevent allergies by exposing the infant to a variety of immune modulating substances that are actually present in the breast milk. And this helps to train the baby's immune system to distinguish between harmful and harmless substances. So this exposure, including the allergens that mom has in her diet, is a continuous exposure. And this actually helps to decrease the risk of developing allergies later in life. So breast milk also contains good bacteria that allow baby to develop these good bacteria in the gut. And this is important in immune protection and immune development from the day the baby is born throughout the baby's life.
I know, Doc, you touched on it a bit earlier. Can you elaborate about the brain development and how breastfeeding will assist with the baby?
So this is a question that has always been asked. So in essence, in a nutshell, brain development is related to good nutrition. And this is what we see in breast milk. The good bioactive factors, the vitamins, the minerals, the fatty acids, all contribute to overall brain growth and overall brain development, and also visual acuity. So there's been a study of over 17,000 healthy infants, healthy breastfed infants. Now, remember, when you look at studies throughout our scientific landscape, studies that we usually take information from, and studies that hold great weight, are randomized control studies where you randomize patients to different limbs of the study, and that's how you do comparisons. Unfortunately, when we study breast milk and formula, it's not ethical to randomize babies to either taking breast milk or taking formula. So we've got to look at as many breastfed babies as possible and compare them to formula-fed babies. So there was a large study done in Europe, and over 17,000 healthy breastfed babies were looked at in the late 90s to the early 2000s, and they were followed up for about 6 to 7 years. And they've actually noted that breastfed babies definitely had better cognitive development at age 6 to 7 years old. And they actually had higher IQs. They had better mathematical ability and better working memory when they were looked at the age of 6 to 7 years. So we know that it improves neurological development, but they've also shown that it's actually linked to changes in the actual structure of the brain. So it increases your gray matter mass, and that is responsible for better decision making, better emotional intelligence, and just better cognitive development. That means breastfed babies can think better and they're smarter.
I definitely was breastfed, doc.
Me
There's
too.
no doubt about
Me
it.
too.
And tell me, what are some essential tips for new parents to ensure their baby's safety and well-being?
So, Shabnam, with new parents, it's a new baby that's coming in. It's a new little human that has just been born, and there's a lot that you sort of don't realize that's going to happen. So, number one, and I think this is really, really, really important, and I'd like to touch on two things. So, basic care of the baby, basic hygiene, cord care. So not every mum realizes that there will be a little cord stump at the navel that needs to be taken care of and needs to be basically cleaned and taken care of until it completely falls off to get a nice pretty navel. So cord care, I'd like to discuss cord care because sometimes in the birthing center, so much is going on that we actually, and this is probably our fault, that we forget to teach mums how to look after the cord. So number one, cord care with every nappy change is really, really important. So we're looking at using colostrum. So colostrum is the first milk that comes out, and the colostrum production happens from about 36 weeks. But we advise you to express a few drops of colostrum onto a little earbud and clean the cord. But if you can't, that's okay also. We use surgical spirits or aqueous hepatine. Importantly, and this is something that I see a lot in my rooms, and I do a follow-up for most mums, especially first-time mums, a week after baby is born. And I see sticky cords, and mums are so scared to clean the cord because as soon as she touches it, baby cries. But I promise you it's not painful. So baby will cry because it's the surgical spirits are cold, you opening, you exposing, you fiddling, but it's not painful at all. So the cord needs to be cleaned with an alcohol-based solution or colostrum right down to the base of that cord, and it must be done with every nappy change, and of course after you bath the baby. And once that little stump falls off, you need to still get in with an earbud with surgical spirits to clean into the center of that navel until it closes completely. And then skincare. So skincare, again, something that I see a lot in my rooms. Now, Maritzburg, it's very cold, especially this year. Winter's been very cold. It's dry. And we find baby's skin getting quite dry, flaring up into rashes. And, we always want to know why. So there are a few views on how many times a week you should bath your baby. And if you read the literature, it will say baby skin is usually, very sensitive, and that's true. And you should bath baby 2 to 3 times a week. Yes, but just be careful if your baby has very runny stools, and if you're breastfeeding, that's what you're going to see, many runny stools that go up baby's back. You may have a baby that refluxes or vomits or posits often. So yes, 2 to 3 times a week, but look at your baby. If you have a baby that vomits a lot or spills a lot, then a daily bath would be advisable. And bath with glycerine based products. Try not to use the branded products. I won't mention any names, but no branded products with colorants and with chemicals for perfume, for scent. So it must be glycerine based, color free, scent free products. And thereafter, moisturize. So you've got to moisturize because our environment is very dry. So the skin tends to get quite dry. It is normal for baby's first layer of skin to exfoliate, to basically peel off. So that's normal, but moisturize anyway. So continue to moisturize and as frequently as you need to, so that baby's skin is very well taken care of, and especially the face. Try not to use any soap-based products on the face, but you must moisturize. Nappy changes, also very, very important that baby has nappy changes as frequently as the feeds, because breastfed babies, and all our mummies are going to be breastfeeding from now on, breastfed babies will often pass a stool every 2 to 3 hours. So that's probably with every feed. So make sure you change those nappies and you use a good bum cream to protect the skin in the nappy area, because that's also important. And change nappies every 2 to 3 hours, or if they get soiled more frequently. Shabnam, reflux is quite a topic that we see a lot nowadays. It's a topic on its own, but I just want to just basically speak about it. So reflux is just bringing up of feeds after a feed. So whether it's with breaking off the wind or even a few minutes after the baby has fed. And sometimes it can happen up to half an hour or an hour after baby feeds. So sometimes reflux happens in the form of a little posit, which is absolutely fine. If baby is not uncomfortable, then there's no issues. But if reflux happens with every feed, and especially if half the feed is being brought up, if baby is symptomatic, is arching her back and is very, very uncomfortable, then I think mom needs to consult her pediatrician, because often it gets overlooked and we find that baby stops growing or the growth is not ideal, and it really, really needs to be attended to.
And then a common factor, doc, that I hear from mums is, you do have the illnesses and infections, but you hear mums battling with babies that have colic, and they are stressed out, they have sleepless nights, and they say, my baby is colic. And then can you just elaborate and guide us on how we can manage a patient, a baby that's been diagnosed being colic?
Very good question, Shabnam, and it's a question that I always get in my practice quite often. So if you look at the actual definition of colic, the definition is incessant, inconsolable crying in an otherwise healthy baby for 3 hours at a time for more than 3 days in a week. By definition, not many babies actually have colic. So colic is not as common as we think it is. Baby may be crying, but remember, 3 hours, more than 3 days in a week. It's not as common as we think it is. Most often, baby is gassy. So colic has been also associated with gas. We don't know the cause of colic, but the most important thing with colic is it doesn't cause any long-term complications. The causes we think are generally unknown, but we think it's associated with excessive intestinal gas. And some experts actually think that it may be related to an immature nervous system. And because this nervous system starts to mature after 3 months, colic suddenly disappears at 3 months, which is wonderful. So, importantly, there are no long-term complications with colic. You'll have to deal with the fussy baby for a few weeks for up to 3 months, but don't worry, it's not going to cause any problems with baby later in life.
Listeners, you're listening to The Pulse Show with myself, Shabnam Ismail, and Dr. Takoordeen, a leading pediatrician in Pietermaritzburg. We're going to take a short break with a soulful nasheed to uplift this beautiful Saturday morning, inshallah. And when we return, we'll unpack more information on pediatrician and the world of neonates.
سبعا سبعا أطوف وأسعى سبعا سبعا وخلف مقام إبراهيم صلاة الله وتسليم وخلف مقام إبراهيم صلاة الله وتسليم لديار الله أمضي أطلق الرحلة أدخل الميقات شوقا أبدأ الغسلا ألبس الإحرام حتى أحتوي معنا وأصلي ركعتين قربة لله أقصد البيت العتيق وألبي في الطريق ربي لبيك فقد جئت من فج عميق جئت يا ربي إليك عبدك بين يديك فاحتسب لي توبة كل آمالي عليك أتيت يا ربه إليك لبيك يا كريم لبيك حن قلبي لبيت ربي حن قلبي لبيت ربي أطوف وأسعى سبعا سبعا أطوف وأسعى سبعا سبعا وخلف مقام إبراهيم صلاة الله وتسليم وخلف مقام إبراهيم صلاة الله وتسليم لبيك اللهم لبيك لبيك لا شريك لك لبيك 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 إن الحمد والنعمة لك والملك لا شريك
Part of the crying baby, I'll speak about the medical things to worry about when your baby's crying.
Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this beautiful Saturday morning on Radio Al Ansar 90.4 and 105.6 FM with myself, Shabnam Ismail, on the Pmb Pulse show, capturing the heartbeat of the community. We are joined today with Dr. Raksha Takoordeen, a distinguished pediatrician with expertise in neonates and premature babies, and who is dedicated to providing compassionate care to children and giving back to community. What sets Dr. Takoordeen apart is a commitment to giving back to community, and she has worked closely with children's homes and organizations, participating in various roles and contributing to times of dire need. Her dedication to providing the best possible care for her patients is evident in her ability to practice healthcare with near first world advances. Welcome back, Dr. Takoordeen.
Thank you, Shabnam.
We're going to dive back in. And I know something that's always been around when I chat to moms is, my baby is fussing, my baby is crying, and, their sleep patterns also kind of interrupt with mom's well being. Can you tell us what are some ways to soothe a fussing or crying baby?
Sure. So babies cry, and babies cry a lot within the first few weeks because remember, their neurological systems are still developing and they're still finding their space, and so is mum. So, as hard as it may seem, mum, try to remain calm because I always say anxious mummies create anxious babies. If your baby has been fed, if baby has been changed, and you're sure there is no medical reason for the crying, and I'll discuss some of the medical problems that you should look out for a little later on. So if you're sure there's no medical reason for baby crying or for the excessive fussiness, there are a few techniques that you can try to soothe baby. So often swaddling the baby with a receiver or a swaddle blanket will soothe because it mimics the cozy, contained womb environment. So baby is nice and well contained, and it will make her feel secure and protected. Sucking is also effective to soothe a crying baby because it releases something called endorphins. Endorphins is like morphine. So it makes them feel happy, safe, protected, and calm. And if there's any pain, it will actually also help with this pain. Help your baby find a finger or a thumb. Try not to use a pacifier. I'm very much against pacifiers and dummies. I believe that babies must learn to self-soothe. And if they suck their thumb, it's okay. We'll deal with it later on. But pacifiers actually cause more complications than learning to suck your thumb. So gently rocking or swaying the baby with white noise in the background or also mimics a very safe intrauterine environment. Massaging a fussy baby can be extremely helpful. So a gassy tummy will prevent baby from sleeping, it will cause quite a bit of discomfort. So just gently massaging baby's tummy in a clockwise direction with flexing of the hips and cycling movements of the legs can relieve that gas. And even a warm bath will often help to calm baby down. And most importantly, if you've tried all these methods and if it's just not working, ask for help. Remember, they say it takes a village. Sometimes with mom being exhausted, baby will pick up on that energy. So ask for help. Ask your partner, ask the grandmother or another family member to come in and just stand in maybe for a few hours so that mom can get some uninterrupted sleep. If though you still feel like baby is excessively fussy, you cannot settle baby down, then a visit to your pediatrician is then warranted. So Shabnam, can I speak about the medical conditions that you should look out for if your baby is excessively fussy? So over time, you will learn what each cry means, what each noise means, what each movement means. Don't stress from the beginning because this takes time. This happens over a few weeks. So there will come a point where you will know and you will realize when the fussing is just excessive. There are a few medical conditions that need to be urgently addressed if you are concerned. So inconsolable fussiness, incessant or high-pitched crying, fever. Fever is something that newborn babies don't commonly experience like older babies. So if you find that a newborn baby has fever, it is serious. Feeding, poor feeding, irritability, lethargy, these are all signs that something is wrong and you need to seek help. Diarrhea, blood, and or mucus in the stool is also a red flag, and this needs to be addressed urgently. Remember though, and we didn't speak about this, but breastfed babies can pass anything between 2 and 10 stools per day per 24 hours. So up to 10 stools if they are small, seedy stools with maybe 1 or 2 large stools, this is quite normal. But if you find that baby is passing excessive amounts of fluid in the stool, then this is a red flag associated with vomiting, poor feeding, any other signs of that you're not used to in your baby. These are red flags that baby needs to consult a doctor, a pediatrician, or your GP as soon as possible. Newborn babies have very, very low reserve. So once they get ill and you are seeing all of these signs, it's very important to seek help as soon as possible.
Doc, you spoke about the importance of breastfeeding, and I know nourishment for our babies are so important. So can you tell us what can parents do to ensure that the baby is getting enough nutrients for optimal growth and development?
So this forms part of a very large part of my discussion with the mum at my 1 week assessment with mum and baby and dad, of course. And my first question to mum is, please tell me about your diet. So exclusively breastfed babies are getting everything from mummy. So if mummy is not eating well, baby is not eating well. So mum's diet needs to be on par. So, and I always say this, and it floors all my mummies, but I'm going to say it anyway. So, mum, you have to eat more than you were eating when you were pregnant. Now, remember, you've just grown an entire human over a 9-month period. Then you delivered, and we are seeing more cesarean sections now than normal deliveries. But either or, you've got to now heal from that delivery. And on top of that, we are now expecting you to feed your baby. So your body needs to heal from making a human, from the delivery process. And now it has to produce extra to feed baby and make sure baby is growing well. So mummy's nutrition is of utmost importance. So frequent meals, and meals must be well balanced with protein, fat, and carbs, and good fats. So we're talking about nuts, almonds, sunflower seeds, pumpkin seeds, avo, your meats if you eat meat. And there must be frequent meals. So breakfast, a mid-morning little breakfast, a good lunch, a mid-afternoon little sandwich or snack, a good dinner, and possibly a snack before bed, and fluids. Mummy has to have at least 2 liters of fluid for the day, and on a warm day she needs more fluids for herself and fluids to pass on to the baby to make that breast milk. So a sign in the baby that baby is getting enough is if baby is satisfied for at least 2.5 to 3 hours. So you fed baby and baby sleeps for 2.5 to 3 hours. Wonderful, baby's had enough. 5 to 6 heavy wet nappies per 24 hours tells us that baby's having enough. And stools are very variable, but passage of stools 2 to 10 per day, they can skip 1 or 2 days. It's absolutely fine, but stool passage important. So, and of course, you need to do regular weight checks for baby. So usually at the pediatrician at the 1st or 2nd week visit, and then at 6 weeks, or your clinic at 6 weeks. And then the weight gain and development is usually assessed by your pediatrician or your clinic sister when the vaccinations are done. And with our vaccination schedule, it's perfect because the first vaccine is done at 6 weeks, then 10 weeks, then 14 weeks. So you have those visits to actually monitor growth and development of the baby.
Doc, it's really an exciting phase, obviously, having a new baby. Can you tell us, in terms of the family members, what is the best support for new mothers and how can one navigate the challenges of caring for a new baby?
So, for new mummies and daddies, having a baby is probably one of the most stressful life events you will ever experience. As dramatic as it sounds, it's true. So, when two becomes three, it's very important to find your balance as a family. So it will be quite an adjustment. There will be sleepless nights. There will be long days until you find your rhythm, but you will find your rhythm. Importantly for mum, like I said, good nutrition, especially when you're breastfeeding, but equally important is rest. So everyone says sleep when your baby's sleeping, and I know there are a million things to do, but this is really important. You need your rest. So when baby's sleeping, you need to rest. You need to sleep. As much as we don't advise visitors, accept help when it comes to meals and other household chores. Continue mummy's pregnancy vitamins. For extended family members, try to allow the new family unit time and space to find their feet. Take the lead from the new parents and allow them to communicate their needs. So don't push visits. Try to support them as much as you can from afar. And once they are ready, they will allow more support within their environment. But importantly, the family unit needs to find their space, their rhythm, their bond with each other. And I think other family members just need to be a little bit supportive in that kind of way, and be there for them when they need it.
Thank you, Dr. Takoordeen, with such valuable information. And, obviously, you've got a busy schedule. You're going to be now, obviously, getting back into your world of looking into the ward rounds and seeing to your patients. And breastfeeding and babies' development is really important. And I hope the mummies out there has taken some valuable information that will help them grow and their babies grow. Do you have any closing messages to our listeners? And how can they get in touch with you?
So, Shabnam, before we close in just a few seconds, I'd like to just mention the donor breast milk bank that we have, that I've been involved in commissioning and running at Midland Specialist Private
Yes.
Hospital. So, just to mums out there who have excessive amounts of milk, we would like your milk, please. So, this milk is there basically. If you donate your milk to us, it's a process that we go through to screen you. We screen the milk and we actually pasteurize the milk and then use this for premature babies whose mummies can't breastfeed. So please, 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 can you try and share your milk with us if possible? I have a number that you can contact, and this is a number that will get you straight into the donor breast milk bank, speaking to the Sister Bongi that runs the breast milk. The number is 033 341 5438. My contact details: I'm based at Mediclinic Hospital and I now have rooms at Midlands Specialist Private Hospital, which I will be opening within the next few weeks. I'm very happy for that. My landline number is 033 342 3098. And I look forward to seeing you.
Dr. Takoordeen, we'd like to wish you all the best in your career and congratulations on all your achievements and hope you grow from strength to strength, especially with your new launch at your new practice. To our listeners, shukran for tuning in today's episode with The Pulse Show. We hope Dr. Takoordeen's expert advice has inspired you to take charge of your baby's well-being. Remember to prioritize your health and well-being, and it's Women's Day today. To all the women out there, please enjoy your day, celebrate strength, resilience, and your achievements. To our technicians, both in Durban and Pietermaritzburg, Brother Asif and Brother MK, Jazakallah for tuning in and coming out today. Have me and your family in your duas, and inshallah, we will connect again next Saturday. It's a wrap from myself, Shabnam Ismail. Assalamu alaikum wa rahmatullahi wa barakatuh.
قلبي